studied medicine in University of Illinois, and my field of expertise is family medicine. I worked as a panel physician in Nigeria, screening immigrants to the United States and Canada. Medicine to me means saving lives, and one of the cases that I would not forget is a 30-year-old male who came to the ER with a snake bite in the region of his neck. And unfortunately for us, we did not have enough antitoxins at that time. And within an hour, he lost his life. So that is why, for me, every opportunity we have is supposed to save a life. And for the pre-med students, one advice I would give is to never stop learning. There's no limit to what you can learn in life. And the topic this evening for me is monkeypox. It's something that is just coming up, but as I mentioned previous years, I'm doing this in conjunction with Starmed Medical Education Program. Now, the introduction, what is monkeypox? It's a zoonotic disease caused by an autopox virus. It usually results in a smallpox-like disease in humans. And there was a time smallpox used to be the issue, but thankfully that has been eradicated. But here we have monkeypox. It was initially diagnosed in 1970 in the Democratic Republic of Congo.
We lost the voice. It was a lot of noise background, and I by mistake I unmuted her. Doctor, you have to, doctor. So we are recording all this. So we have to go back. Dr. Sarah. Dr. Sarah. I cannot unmute them. Dr. Sarah, we cannot hear you. Can you please unmute? Thank you.
Okay, can you hear me now?
Yeah, so.
Okay. Okay, so I think we stopped at the transmission.
Okay.
And how is it transmitted? Like we said before, is a zoonotic disease, so it is transmitted from direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Going to the signs and symptoms, it's just like your usual flu-like symptoms. You could have a fever, a headache, muscle aches, back pain. One could also present with low energy and enlarged lymph nodes. And the symptoms usually last between 2 to 3 weeks. Now, how to treat it? Just like every other viral infection, the key things are to keep hydrated, to eat well, and to treat symptomatically. Thank you.
Excellent. Thank you so much, doctor. So who is next? Vanessa has a question for the doctor. Vanessa, yes?
Hello, Dr. Sarah. I have a question about the zoonotic virus. So do we know if it's something just like the COVID variant, if it's a virus that has perspectives for mutations? Like, is it like, do we know of like strains that just like, the COVID virus has like the Omicron strain, the Delta variant, all of these things? Is that something that could be hypothesized that this could happen for the zoonotic virus? And if that is the case, are there like, do you know of any like present, I guess, vaccines that have been formed to target this? I know it's pretty new, but I was just wondering about like your far knowledge about this so far.
Thank you so much, Vanessa, for your question. And just like you said, it's pretty new. And just like most viruses, it's something that we're still learning about. So right now, just like you said, they're still working on it. And even as we speak, there's a process that they're trying to even make a vaccine for the monkeypox, and so many other studies are being worked on. So right now we don't have a clear picture of it, but I'm sure over as the years progress, it will become clearer. Thank you.
Thank you.
Who wants to go next? So if I look here at the list, we
I think the next is COVID, Dr.
okay.
Silverman. But I am after COVID, I am the next one.
So okay.
Dr. Silverman, I think you just skipped some of us because I'm before Sarah.